As respiratory passageways enter the lungs as primary bronchi, they begin to break into smaller and smaller passageways, secondary bronchi into tertiary bronchi, and then into a series of bronchioles, which can be subdivided. When bronchioles begin, they are about a millimeter in diameter, although the size will continue to decrease, and terminal bronchioles are about half that size. They maintain smooth muscle in their lining, which allows bronchoconstriction, and the relaxation of this muscle allows bronchodilation. Bronchoconstriction would thus limit the amount of air passing through a bronchiole. Bronchodilation would allow more. Because the bronchioles no longer possess the plates of cartilage found in the bronchi, the remodeled airways of asthmatics become much thicker, and thus when bronchoconstriction occurs, this can completely block off the airway. The epithelial lining of bronchioles can change as one progresses from the bronchi to the alveoli. The epithelium, which begins as pseudostratified columnar epithelia in the bronchi, then is described as simple columnar, and then simple cuboidal, before becoming simple squamous in the air sacs. It is ciliated along this route so that fluid which may bind debris can be swept away from the air sacs. And so there are ciliated columnar epithelial cells and then ciliated cuboidal epithelial cells in the bronchial lining. There are also other epithelial cells in the bronchial lining, including the bronchiolar exocrine cells, also known as club cells or Clara cells. Their number gradually increases as one progresses from the bronchi to the respiratory bronchioles until the point where they represent the majority of the epithelial cells lining the bronchiole. Their number increases as the number of goblet cells decreases. They secrete a number of components to the fluid which lines the bronchiole, including the CCSP, the Clara cell secretory protein. This is the major protein in bronchiolar fluid, and it affects responses to foreign substances. In addition, they have microvilli, which increase their surface area for secretion and absorption, and abundant SER, where they synthesize the cytochrome P450 enzymes, which probably play a role in detoxifying foreign agents which irritate the respiratory pathways. There are also stem cells capable of dividing and producing multiple cell types, and thus function in the regeneration of bronchioles. The additional types of epithelial cells in bronchioles include pulmonary neuroendocrine cells, especially in the bronchioles of fetuses and newborns. These cells can be found in distinct corpuscles, and they respond to stimuli ranging from hypoxia to nicotine, and can release signals, including serotonin, which then affects sensory neurons, the smooth muscle of the bronchial lining, and immune cells.